Why Medicare for All is going to remain a hot issue. What you need to know. Hi, everyone. Welcome to the Healthcare Secrets Podcast. I'm John Daly, along with Judd Anglin, the author of the book, The Big Book of Healthcare Secrets. And Judd, let's bat around some thoughts on Medicare for All so people can see a wider view of the issue, because we are getting a lot of notions both for and against, and to be honest with you, not a lot of reality or facts. So let me jump into this, and then I'll let you run with this. We've all been hit with a ton of media about Medicare for All. Democratic candidate Bernie Sanders is pushing it even on Fox News Town Hall. And Medicare for All is getting traction from a sizable percentage of Americans. Some polls have it at 50%, but other polls show it at 10% if it means getting rid of all private insurance, which leads to my stand, which is, well, Medicare for All is kind of okay as a choice, not as a mandate. Tell me what you're seeing.
Well, first of all, you got to start with the term Medicare for All. It's not really Medicare for all. I think it's actually single-payer health care.
Okay, but again, I don't think it really has to be. If you look at the majority of Americans, they really want to keep their private employer insurance, even though they seem to be siding with Bernie.
Yeah, I just don't think they understand the real cost of what it's going to take. The cost projections right now are $32 trillion over a 10-year period.
Yeah, and that's been documented on a lot of sources. And for me, Medicare's already stressed. Now the thought is this: if you bring in more younger and healthier people to pay Medicare premiums or whatever they will be paying, then the cost of health care and maybe the deficit of Medicare might go down. That is the thought. What do you think about that?
I think that's very, very naive and unrealistic, and it's a nice thought to have that would take care of that. But if you look at, again, the cost projections, $32 trillion over 10 years. Let's break that down a little bit, because nobody ever does. Taxes for most Americans would have to double. Over a 10-year period, it would be $3 trillion a year, and that's how much taxes that the federal government currently brings in. So yeah, you're gonna have to double that. And of course, people are proponents of Medicare for All. They always say that they'll just make the billionaires pay their fair share and they'll take care of it. But if you think about that realistically, we could round up all the billionaires in America, and we would have to tax them at 100% to get to that $32 trillion. So that's not going to happen. So what's most likely would happen is that it wouldn't be just the billionaires, but it would trickle down to the middle class that would have to increase their taxes significantly to support this. So when Bernie Sanders makes the statement that we'll just charge the billionaires and it won't be that much extra, and he kind of avoids that topic, but the fact is more Americans are going to pay a lot more for it. It will not be free.
Okay. Now, you also think there's going to be a lot of job loss.
Absolutely. I think there would be hundreds of thousands of jobs that would vanish very quickly. I mean, think about the insurance industry. How many insurance companies are there, and all the staff, the custodians, everything that goes into the insurance industry itself. But so I'm not just talking about doctors and hospitals per se. It's really all the ancillary businesses around healthcare. And there's so many, because it is, the most profitable industry, I think, in the history of the world. So there's a lot of support that goes into healthcare outside of the hospital.
Mm-hmm. Yeah, and I agree with that. I'd give a little pushback on the other side. I would say that really a lot of that is unnecessary. And you're creating an industry so that you can soak a lot of people for unneeded healthcare costs or for costs that are way out of line compared to other countries. I think employers should stop providing healthcare to employees. In fact, I would abolish it. If you're an employer, you can't give health insurance to your employees. I think people need to get it on their own. And again, I'm leading into, because we're going to talk about solutions at the end too, what we think the solutions are. So for me, I think the problem is in the way the system is set up now. And to me, the Medicare for all isn't, I don't think it's really a solution. And two, I don't think it answers the problems that we have here. So I would, and I know you agree with this too. We just come at it, I think, in a different way. People need to get it on their own. And the fact that you are allowing your boss to determine what your health care is, you have no skin in the game. So you're just whatever the boss says. And what the boss is going to do is he's going to get whatever good deal he can get from the health insurance company. But the health insurance company wants to see higher rates because that's how they make their money. So you're paying that extra premium because it's going into the pocket of this other industry that you're paying when you don't need that. And
John, I think... Oh, I'm sorry. No, I was just going to say, you're really hitting the nail on the head here. And this is something that I thought that the quickest solution to the exorbitant cost in healthcare, imagine if you insurance companies were left on their own, they got no support from the government at all, and then we got off the employee-based insurance, like you said, and let the insurance companies face the American population without any protection at all from the employees, from the government, and then create catastrophic policies where, if you get hit by a bus or you get cancer or whatever it is, you have a catastrophic policy that you're not going to go financially bankrupt, right? Mm-hmm. You're going to be protected. But let's say you set the deductible at $10,000 for everyone. Imagine what that would do, first of all, for our health and how we'd start paying attention to it. But then the hospitals, the doctors, everybody would be like, holy crap. Now the deductibles, they're going to be shopping like crazy. Mm-hmm. And that would bring the prices down probably overnight.
But don't you think in the short term, though, I mean, you're asking people who maybe, make $50,000 a year, for their family, and they got to pay $10,000 out of pocket.
Yeah, I mean, that's obviously a lot, but you would start paying more attention to your decisions. Mm-hmm. But let's say you would have choices in there. I mean, you don't have to get the catastrophic policy, but I think that would be the best at bringing the cost down. Mm-hmm. But for those middle class that can't afford the $10,000 out of pocket, maybe they could pay a little bit more premium and bring it down to, $5,000. And even that's expensive for a lot of families, of course. But I mean, that's something that you can put on your credit card and manage over time.
So, let's get more into the solutions in a bit, but talk about how, if that system that you and I are talking about, in other words, raise the deductibles, people go out on their own, that's almost impossible to happen just because of the healthcare industry's the amount of money they put into the politicians, the amount of money they put into both political parties.
Yep, I totally agree. Back on topic here, Medicare for all and why it's not going to work. I mean, that also is probably naive and idealistic a little bit, but I've always thought that would really bring down the cost very, very quickly. But, back to Medicare for all and why it's not going to work is like another thing that, we've seen a lot of the polls out there, and about a little bit over 50% of the population totally supports the idea. They want to have it, right? Mm-hmm. But then the other 50% or thereabout absolutely does not want it.
Right.
So that's a huge problem because, yeah, we can get Bernie Sanders and he can try to get Medicare for all. But when you have, roughly 50% of the country that is basically saying, no, we don't want socialized health care, what would what are they going to do about that? How are they going to resolve that issue?
Yeah. Well, and at the same time, too, just what I said at the top of the show, and this was based on a story from The Hill, thehill.com, was that only 10% want it if it's going to get rid of private health care. So I think the bottom line is that people have to become more educated about what's going on in healthcare. I think people have to find what the reality is. They either bounce from one extreme to the other, and the one extreme on the right is unbridled capitalistic healthcare, which, one, it can't work because you don't have what I would call the supply and demand there, because if you are saddled with a horrible disease or you're saddled with a horrible accident, you don't sit there and barter on supply and demand. You'll do whatever it takes to either save your life or whatever you'll do to save your family's life. And as a result of it, supply and demand goes out the window. You're willing to pay anything. So on the unbridled side, unbridled capitalistic side, we don't need to be going there. We need to have something in place, whether it's nonprofit or some sort of regulations. On the other hand, going the completely opposite direction where we just say the government can handle it. They can do it. No, the government's going to be just as bad as the unbridled capitalist. We have to be the ones to take control. And we talk about this a lot. You talk about this a lot in your book. I got this from Wayne Dysinger, who is at Loma Linda. He's a direct primary care doctor. He specializes in it. And all the research shows 90% of what ails us as a country can be cured or controlled by lifestyle changes: diet, exercise, good sleep, reducing stress. Those are just 4 of about 10 that you can be doing. And we need to take control of that. And we as a country are not. We are very willing to say, no, let the government take care of that. No, let my boss take care of that. No, the only way you're going to reduce cost and you're going to get better health care is if you as an individual become an entrepreneur on your own health care. And that's what you and I talk about on this show, and that's what most people aren't doing. And they're just pushing it out. Oh, I want government to do it. No, I want my boss to do it. No, you do it. And that comes back to, let's talk about your solutions, especially the solutions in your book.
Yeah, John, just real quick before I get to that, I mean, I just want to add another point. And to your point, what you were just saying is that there's no one-size-fits-all solution. I mean, think about that.
True.
And when it comes to health, we're all different. You know, we have different issues, different problems, different stress points. So there's no one-size-fits-all solution. So I just think your point is so important that I just want to emphasize that. And that doesn't mean that, you know, the people that can't fend for themselves and through no fault of their own have some, you know, let's say a genetic disease. We have to take care of those people, no question about it. You know, as a community, as a neighbor, as, you know, a family member, or even if we have to, the government. Those people need to be taken care of. You and I would never argue the other, you know, otherwise. But you're right. We have to get back to the individual level and take responsibility for our own care. And that's, you know, why I wrote the book, because, you know, as I pointed out, I found all these solutions that nobody's telling people about. So that's why you should really get a copy of this book and, you know, keep it in a drawer or keep it out on your desk or whatever. But you're going to find so many incredible solutions that are just affordable that nobody told you about before.
And these are solutions you can do without having insurance.
Absolutely.
You can go insurance free and be healthy and maintain your wealth too. And that's one of the reasons why you need to take a look at this book. Again, it's on our website, which is the healthcaresecretspodcast.com, and you can get the book there. Obviously, we want people to follow our podcast because we think we've got a lot of solutions. And what we're going to do is we're working with a number of different companies. We're going to try to find the real solution. So we're actually working on it because we know it's, as someone says, there's a pony down there in that pile somewhere that we can find. We also talk about Liberty Health Share. We talk about medical cost sharing. And for me, that was a turnaround for me because I ended up saving in the first year. I ended up saving something like $14,000, $15,000, and my healthcare was taken care of, and I saved $15,000. So I can only imagine what some families are going to have to go through if they went to something like Liberty Health Share or medical cost sharing. Talk about that just real briefly before we wrap things up.
Yeah, John, I'm also on Liberty Health Share. My family, we save about a little over $12,000 every year. We've been on it for about 4 years now, and I just love it because, you know, I've mentioned in previous podcasts that it is so simple. There's no trickery about it, you know, no small print. Basically, if you need any kind of medical treatment, you have a little card, just like, you know, insurance, but it's not insurance. But you present that card, and you can have your bills sent to Liberty Health Share, and they pay everything. Once you reach, the annual unshared amount, that's a portion you have to pay out of your pocket before you can start using it. But ours is about, I think it went up to $2,000 now, close to $2,000. But that's it. Once we reach that threshold, then they'll share up to $1 million per incident. So we feel very safe with that. But the best part is there's no network. We can use it anywhere we want. In fact, anywhere in the world. So it's great for traveling. If we're abroad, we're in Europe somewhere, and something happens, we can go. As long as the bill's in English, they're going to share those expenses. So I couldn't be happier with the program.
Yeah, and we could go to Health City, Cayman Island, and get treatment there, and they would accept it.
Absolutely.
All right,
yep.
Good. All right, so there you have it, folks. Keep it tuned here, because we're going to have a lot more information on this, because you're going to hear a lot of different things, and you're going to hear a lot of different things that the media either won't tell you or they don't understand. So we have it here for you to at least guide you along the way, so you can do it as well. And again, as you're looking at stuff like this, you've got to be proactive. Not only in your health, but you got to be proactive in what's going on in healthcare legislation, so you really understand what it is. Because you've got two poles on different sides that are trying to get you to do almost the exact same thing, and that's to have you lose control of your healthcare so that they can make more money. So anyway, there you have it. Secrets podcast for today. Our website is healthcaresecretspodcast.com. Judd's book is called The Big Book of Healthcare Secrets. It's there. You can buy it. It will save you thousands of dollars. You can also check us out on YouTube, Facebook, and Twitter. Make sure to tell us your thoughts. Judd, another great show.
John.
All right, folks, keep listening. Stay healthy.